welcome back. Welcome back. Joining us for our first conversation. It's all about Wellness Week here in Belize, and we have with us on the couch Ms. Kathleen Azueta-Cho, and she is the technical advisor of HECOPAB. Good morning. And joining her, we also have Dr. Karen Roberts, and she is a technical advisor of non-communicable diseases and mental health over at PAHO. Good morning, ladies.
Good morning.
Thank you so much for making the journey as well here over to talk to us about Wellness Week. So let's talk about the theme going into it and the objective of Wellness Week.
Okay, so pleasant good morning to you both and to Dr. Karen. It's a pleasure to be here joining you all. Wellness Week 2025 is celebrated this year under the theme Together, working together we can build a healthier future, and it really focuses on the promotion of healthy lifestyles, and it's done in collaboration with PAHO, the SICA countries, because it's both a Caribbean and Central American initiative. And like I said, it's done annually because we do see a heavy burden of non-communicable diseases in the region. And so it's an opportunity for us, along with our partners, to remind the public on the importance of prevention through healthier behaviors, promoting healthier behaviors. So that's the idea. And also to encourage community partnerships. This can't be done on an individual level. It does require the collaboration of communities, schools, workplaces, and different organizations that also prioritize the healthy lifestyles.
I think that we've been thinking about health for a long time as just your physical health. Yeah. And now with Wellness Week, we're seeing it as an expansion of beyond physical health. You're looking at emotional health, mental health. Let's talk about the definition of wellness, Dr. Roberts.
Well, wellness is a term that we would say is relative. Because if you look at wellness, you can put it on a line where you're at zero, where you're enjoying good health, you're healthy, you know diseases, good mindset, everything like that. But then you can also move to the other extreme where you're sick, you're not well in your mind, and so on. For each of us, sometimes I can be 3/4 way on the line but still enjoy a relative sense of wellness, you know. But basically when we think about wellness, if you think about what WHO says in terms of health, they say it's a complete state of physical, mental, and all these elements. But I will also say that there's relative kind of wellness, because I can be sick, but if I'm on my medication, things like that, I can still enjoy the optimum kind of health. So that's how I would define it.
How do we promote an awareness of health and wellness in the face of all the challenges that we face individually and perhaps as a society? So if we're looking at, for instance, obesity, hypertension, diabetes, and all these other illnesses, and you look at the fact that perhaps a good percentage of the Belizean population is faced with these particular illnesses, how do we say to them effectively, you need to be more mindful of your well-being, your individual well-being?
So through Wellness Week, this is a week where we're reminding the public to take small steps, practical actions, such as drinking more water instead of the soda, moving more if you're sitting a long day in the office. And we have also policies that we have developed very recently, such as the National Nutrition Policy, we have the breastfeeding policy. All these are reminders for us of the progress that we have made, the ministry and the country. I think the promotion of enabling environments is very important because we can get very focused on our busy lives. And so one of the things that we try to encourage workplaces is the promotion of enabling environments. And schools, we have the Healthy Habits. That's an important initiative that looks at the promotion of healthy lifestyles. What are some of the healthy habits that we can start encouraging from a very early start? As Isani rightfully said, the Belizean population is facing many challenges as it relates to some of the diseases that we are facing. Non-communicable diseases are among the top 5 leading causes of death. And a substantial fraction of that is seen at a premature age, before the age of 70. So that tells us that there's a lot to be done in promotion of healthy lifestyles, early detection, early diagnosis, which would mean earlier treatment. So we could start doing these from an early start and prevent. That's the good news, that a lot of these diseases like diabetes, hypertension, they're all preventable.
I often feel a certain way whenever I go do a consultation at a doctor, and I feel awful. I don't necessarily have a disease, but perhaps I'm breaking out, or perhaps I have fatigue, or I feel a certain way and I just don't feel well. And every time I go to the doctor, they say, "Are you stressed out lately?" Because perhaps it's because you're stressed out that you're probably not feeling well. But I live a very fast life, so how am I supposed to prevent stress and do all of these things to keep myself healthy and also do my day to day?
Yeah, and responding to that, a lot of times we're products of what we eat, what we drink, and how we are able to manage stress and adjust to changing circumstances. And when we talk about what we eat, I mean, we eat foods that are high in salt, we drink things that are high in sugar, you know, a lot of trans fat, a lot of fatty food, fried foods, things like that. In addition to that, a lot of us don't exercise, right? And when I talk about exercising, I'm talking on a daily basis. Some of us smoke, some of us consume alcohol on a regular basis to harmful amounts, and then some of us are not able to manage the everyday stresses of life. We don't talk about things that worry us. We don't get enough rest. You know, making reference to you, you find that many times the likelihood of doing long hours, you know, and really pushing yourself without ensuring that you're getting adequate rest and sleep. And remember that this is the electronic age where we have cell phones. By the time they go ping, you know, we take them up and so on. And all those things take away from our ability to balance and to be able to cope. And gradually, it's like a vehicle. If you're driving it every day, you're not doing any kind of maintenance. Our bodies operate the same way. That if we're pushing ourselves, we're not eating healthy, we're hardly drinking water, you're not getting enough sleep, after a while, you know, we're going to begin to feel unwell. But drawing on the point that you were making, a lot of times we're very reactive in terms of our use of health services. And when I say that, I mean that we only go there if something is wrong.
Yeah.
What we want the population to get into the habit of doing is go to your health center, your primary health care center, to ensure that you stay well. So you're not going there because behind my head is hurting or anything like that, but you're going there because you understand that wellness is important. And if you don't do routine checks to see how you're doing, you wouldn't be able to pick up anything as soon as it begins to happen.
And that's the thing, like, I believe so many of us don't do checkups as often as we should. It's like what you said, Dr. Roberts, we are very reactive. We wait until something feels off, or we can't move, or you have a headache that you can't explain what's the cause of the headache before you access the health facility. But it's not like you're doing that when you're perfectly together, in a manner of speaking. It's always a matter, something has to happen, then we go to the doctor and try to figure out what's taking place. So that is one aspect of our conversation this morning, The other aspect for me would be to ask, what are the activities that are scheduled for this week in commemoration of Wellness Week?
So we have a calendar of activities starting from today, September 23rd to September 30th. As you could see, each day focuses on an important aspect of wellness. So today we have Team Spirit, a healthy start, and it really looks at the workplaces and how we could prioritize unity, team building exercises. I know in Belmopan and in Orange Walk and in some of the other districts, our health team will be visiting the elderly homes, working with different groups, because it's also important to work with inclusivity and ensure that we are targeting different audiences, schools, communities, older groups. Another day looks at safety, the mental health. Mindfulness is very important. We also have nutrition awareness days, the promotion of drinking more water, fruit days. Again, these are all small steps each day that we can take to remind the public that we can make better choices. And so that's the idea, to have a day that focuses on different activities. And we have to thank the district teams, because these are activities that are taking place across the country. And that ensures that we are not leaving anyone behind, and that we are focusing on bringing health services closer to you, closer to your workplace, closer to the schools. Not, as you all said, people wait until it's too late. And so the promotion of protective factors, and not always looking at disease, the spectrum, but looking at what we could do, focusing on positive reinforcement. And I think that will help people to grab on more and take action than looking at it as this is work, you know, when it should be part of our healthy day-to-day activities.
How do you all collaborate and, I guess, partner with non-health institutions, perhaps other businesses and corporations, that you have a mindset of it's an 8 to 5 job, we have to do this, you have to sit at your desk? How do you all perhaps maybe campaign, create programs for some of these spaces so that their employees can feel better while they're in a work environment?
We work a lot with workplaces. People are often tied to their hours and their duties and responsibilities. So very now we go out. Sometimes it's a request that the workplaces bring to us, but at the same time we also want to empower employers. And we've done workplace forums for the past 2-3 years, and that has really brought an increased awareness to the employers to say, you know, we need to take care of our employees, and we need to ensure that they are well-rounded and making the right steps, because then that means we will have a productive economy. There will be less absenteeism, less illnesses, you know, sick days out will be reduced. So they have really come to grasp that understanding, and we have invited them to take on some of these activities. Next month, I'll use an example. We met recently with the Belize Sugarcane Farmers Association, and that is so that we could go and invite cane farmers to come to our sessions and learn more about the importance of drinking, staying hydrated, and that way, you know, we are seeing less kidney problems. So that's an example I'm using, that we will start reaching out more to these vulnerable groups, at-risk groups. We know what some of these groups are based on the demographics, based on the disease profile that we're seeing. So we have really found the collaboration with workplaces too. It has strengthened, and we have schools as well. Schools are a very important group that we're working with. We have the Healthy Habits. In August, the nutrition unit, along with other partners, they trained youths from 7 schools, and these are 14 youth nutrition advocates who we've trained and empowered to go out and take on some of these activities at the school level, so that the Ministry of Health and other partners don't always have to go in, but they can take that initiative to do those activities. So those are just some of the examples of the initiatives that we are working on.
I think it would have probably been easier, just my thought here, probably been a little easier to introduce healthy eating habits and stuff to kids at the primary school level than it is for employers to wrap their minds around allowing for their employees to be able to take time to exercise or do other activities that build fitness and health and wellness and what have you. Simply because I think in my mind, when I think of a boss, they're thinking about productivity from the time you report to work to the time you leave. And for them to say, well, I'll give you an hour to you know, exercise around or build a small little fitness facility at the office or something, it's farthest from their minds.
And I think with awareness, because we have to start somewhere. With awareness, I think more and more employers are understanding that, look, if you don't have healthy employees, it's likely to impact the environment in which they operate and productivity, of course. And as a result, I think that you're seeing more and more concerted efforts towards ensuring that, you know, people get leave when they need to get it, time off when they need to get it. You know, you encourage them. I mean, I know some environments where supervisors literally ensure that everybody leaves at a certain time. Because sometimes there's a tendency to stay back. I know here in Belize that's not the culture, right? But
here in Belize,
5 to 5, we don't clear the desk, put out the computer, everything.
I don't know, yeah, but that's not where I work.
you know, but I know that some environments people go in early and they work very long hours, and sometimes we use that as an indicator of performance and productivity and so on. But then after a while, that person begins to get sick, and we don't attribute it to those long hours and so on. So I think it's to the benefit of employers to ensure that they not only set up wellness programs for employees, but to be able to encourage the kinds of healthy behaviors that we know will go on to ensure that your staff stay healthy and that you enjoy the kind of productivity.
I know that there are some private institutions now that are looking at like mental health as something that they have to keep a close eye on. I think you have certain institutions like Galen that they have their in-house counselor, the lecturers and students, they have to at least once a week go in and check in because it's part of now their mandate, right? But I think for Belize, we're still in this sector. I don't want to talk about my stressful problems. I don't want to talk about my issues, and then that also leads to other health issues along the lines. Let's talk about the importance of mental health.
And mental health is important because when we think about an individual, there's the biological side, there's the psychological side, the social side. Some people will have a spiritual side, and of course the mental aspect. And you find that sometimes when the other elements are okay, when I was a child, my mom used to like to say, what affects mind affects body. And as a result, mental health is important. Staying healthy, being able to adjust to changing circumstances. I find that most times people find it difficult. Once there's a change, people find it difficult to make the necessary adjustments, to adapt to changing circumstances. Life is not static. And as a result, you have to have the ability, I mean, the first 2 or 3 days or 4 days, you will have a challenge, but eventually, any normal person is supposed to be able to come along and to be able to just adjust. And then this whole issue of managing stress. Sometimes we take on so much. We worry, we don't talk about the issues, you know, and as you were saying, the tendency is not to talk. Is it because people don't trust the environment? You know, is it because there's a lot of stigma? you know, surrounding where if I were to talk about my issue, you'll feel that something is wrong with me, you know, things like that. So a lot of times those are some of the factors that prevent people from talking and from going to seek the kinds of care and help that is needed. And particularly in the home, as we deliberate Wellness Week, it's always good to encourage children to talk. It starts from early. We usually say adolescents don't talk, but if we don't cultivate the habit in them from early, talking about issues and feeling confident that what they say will stay with you, then you find eventually people get to the point where they don't trust the environment and they don't say what needs to be done. And there are ways of helping us to cope mentally. Physical, finding physical activity. We don't know how important, you know, playing some kind of sport, going for a walk, you know, things like all of those are things that help us to distress and to relax. All of us have ways that we cope. You know, we might do word search, we might listen to music, things like that, you know. Many times people turn to substances, but that's not usually, that's not a good way of managing stress. And sometimes you might hear people say, oh, I feel stressed, I'm going to go home and drink a glass of wine. I mean, I don't know about the science so much about that, but then we have to be careful because one glass of wine might do it, but then eventually you need two and then three, and that's where it starts. So we have to find healthy ways of managing stress. And during this week, I want to encourage our listeners to go out, walk, talk with people.
Get off your phone.
Yes, put away the cell phone and just relax and go out in nature. Belize is a beautiful country, you know. I'm sure that Belizeans don't enjoy their country as much as other people who come here enjoy. We don't know the calming effect of nature, you know, and there's so many things that could be done, not only during this week, but we have to make these everyday lifestyle kinds of behaviors, and we'll reap the benefits.
It takes about, what, 21 days to instill a habit and to ensure that you keep it, right? So for our viewers out there, once again, the activities line up for this week. This is countrywide.
Yes.
Okay. So
this is countrywide. We invite the public to check out our Facebook page, the Ministry of Health and Wellness. We have activities that are ongoing. In every district, you could contact the HECOPAB office. These are the officers on the ground who are part of the health team leading these activities. And like I said, you can start at your school, at your workplace, having a health walk, doing a healthy potluck. I know at the office we have an activity where everybody is invited to come dressed in an 80s outfit, just to make it fun and engaging. But these are just ideas, and it helps with the mental aspect. You know, you're creating a fun environment. So that's the idea, to make it a full package. And we even have Safety and Self-Care Day, right? Taking care of yourself is important, as Dr. Roberts mentioned. Safety, we have a road safety campaign taking place up in Orange Rock by the Tower Hill factory, and that's again an important message to say, let's drive safely, buckle up. That's again, don't drink and drive, and stay off your telephones while we're on the road. So again, the activities are really encompassing important aspects of wellness. So we invite you, use the hashtag wellness 2025 and tag us, and we will be sharing your activities. Again, it's a reminder to take small steps, but these sum up and make a very important difference in your life.
wonderful. Ladies, thank you so much for joining us this morning. Before we head on to our commercial break, I want to share the motivational moment with you all. And I think it ties in very, very well with our conversation for this morning. It says, the happiness of your life depends on the quality of your thoughts. The happiness of your life depends on the quality of your thoughts. And that is a quote by Marcus Aurelius. Beautiful. Thank you so
Thank
much
you too.
for joining us.
Thank
We're going to take a quick break, and when we come back, it's all about University of Belize's Pharmacy Club. They're going to be highlighting the power of medicine.